for the Aspen Institute Forum for Community Solutions. Welcome. Thank you for coming. To get us started, I'm going to introduce Steve Patrick, who's the Executive Director of the Aspen Institute Forum for Community Solutions, and the Vice President here at Aspen Institute to get us kicked off.
Thank you, Sherry. Actually, thank you, Sherry Brady, for putting this whole thing together and all of your leadership at the Aspen Institute and your focus on solving the complex problems in our country and addressing inequity. You are really a beacon for our team and for this work, and so I want to thank you for putting all this together, Sherry Brady, right now. So Sherry already mentioned, I'm Steve Patrick. I'm Vice President at the Aspen Institute, and I also have the great privilege of being Executive Director of the Forum for Community Solutions. This is where I am supposed to drone on about the amazing work that we do at the Forum for Community Solutions. I am not going to do that. I'm just going to ask you to go to www.aspenCommunitySolutions.org and check out our stuff. Wow, it's amazing to see how many people are writing down that website in the room. No. Thank you, those of you who are welcome to all in the room, and thank you to those of you who are watching on live stream for writing down www.aspencommunitysolutions.org. I think many more folks did that on live stream than in the room. And it's a real privilege and a pleasure to be able to leverage the Aspen platform for this incredibly important conversation about this incredibly important book. So this is going to be really interesting, and I don't want to take too much more time, but introducing it. I want to get into the meat of this important book. So let me just tell you, we're really, really pleased to be a partner in supporting the book, 20 Years of Life. And I think it's important to name the subtitle, Why the Poor Die Earlier and How to Challenge Inequity. That's a powerful statement. It's one that needs to be addressed in this country. The gaps we know are significant in terms of not only access to opportunity, but actually access to a healthy and fully actualized life. And the book has received praise from far and wide already, and it's just been released. And I think what Suzanne Bohan has done here is provide a graphic description of how poor living environments affect our schools, housing, food availability, safety, recreation, environmental toxins, and a sense of community. And she shows how these forces impact one's life. She also offers up some solutions, and I think that's a really powerful piece of the book. So I encourage you all to check it out. And let me just tell you about Suzanne and then ask her to come up and introduce some of the key lessons and themes from the book. Suzanne covered health and science for 12 years with the Bay Area News Group, a 650,000 circulation newspaper chain that includes the San Jose Mercury News, the Contra Costa Times, and the Oakland Tribune. She's won nearly 20 journalism awards. I think there are some future awards in her future, including the 2010 White House Correspondents Association Edgar Allan Poe Award for the series Shortened Lives, Where You Live Matters. She's also won a National Health Information Award for the Health Promotion Disease Prevention Society. She has a master's degree in journalism from Stanford and a bachelor's degree in biology from San Francisco State University. She interned at CNN and worked in radio, but decided to focus her career on print media. Thank you for that. I'm sure sometimes you question the career choice, but we're very pleased that you are so adept at print media. And she lives in Northern California with her husband, who's here today. So without further ado, the author of this great book, Suzanne Bohan. Thank you, Suzanne.
Thank you for that lovely introduction, Steve, and thank you, Aspen, for hosting this wonderful event and for Sherry and your partnership in this project. And good afternoon, everyone, and thank you all for coming out, and good afternoon to the live cast audience. We are happy to have you. And it's always good coming out to DC. I was born a few blocks away in GW Hospital, and I was actually born a Virginian. but my family moved west shortly thereafter. But it's always a type of homecoming to be in DC. And I want to move on to bring a quick, let's go to start this slideshow. I want to just describe to you how I got started covering health disparities. Okay, Sherry, this is where you come in.
Sorry.
Okay.
This should be. Sorry, guys. Technical difficulties.
There's always that comic relief. This even happened at an Apple show
go.
with Steve Jobs. So, okay, great. So this is the series that really first introduced me to the whole issue of health disparities, that won a lot of national attention, and piqued my interest in covering health disparities to a greater detail and in more depth. And in the course of researching that series, I also learned about, in my area, a new initiative starting called Building Healthy Communities, put on by California's largest healthcare foundation, the California Endowment. And it was going to be taking a novel approach to health. I had covered health for years, and mostly I talked about health insurance coverage and lack of medical care and so on. And this was a whole different message that really appealed to me and made sense. It was about building up political power to give poor communities a seat at the table. If you think about it, politics is really about the allocation of scarce resources. And if you're not even at the table, you get ignored when those decisions are happening. So this is empowering communities to find effective voice and divert revenue streams into their communities on a sustainable basis, and also to create policies, to demand the same kind of policies wealthier areas enjoy. An irony that we report in that series is that one wealthy community in the East Bay forbade diesel trucks on their highways. How handy. Well, then they all went through the downtown area in the poor sections where they dealt with all the particulates and so on. So this is the BHC community. I traveled from tip to bottom of the state reporting on it, which was really a great adventure. And it starts with, this is a really unique one. This is Del Norte County and adjacent tribal lands. It really reflects rural America. It's largely white, but it also has the largest Native American tribe in California. So I think it's the first time any community change initiative is undertaken working with Native Americans, and it's been fascinating. And then here's all the others you may be familiar with. There's Oakland, Richmond, Central Valley communities, and Southern California, and so on. And it's really the central focus of the BHC campaign, as I describe it, this is my language, is to build up political power in distressed communities so that when it comes to allocating public resources and in establishing health promoting policies that wealthier areas enjoy, they too have a seat at the table. The book starts right here. This is in front of LA City Hall. And this has to be one of the first rally ever held to object to lifespan differences. And this followed an LA Public Health Department report on the subject. These are people who lost relatives early in their 50s, and they had very moving stories. It was somewhat of a staged event, but it was nonetheless very moving. And this is a slide in my stress chapter. I have a chapter on chronic stress, which really, if you drill it down, it's the underlying factor behind health disparities, that chronic stress just wears you down and it gets in disequilibrium. Now, this is from Wake Forest, where I visited. And on the left is the dominant monkey, the subordinate. And it shows how you see far more plaque buildup in the subordinate on the right, dangerously narrowing the artery. Despite the fact that both are the same age, fed the same diet, got the same housing and same veterinary care. The scientists link that difference to the stress burden borne by the lower subordinate monkey. Now, this is Cameron Simmons, a very resilient young man. By his junior year, he'd been suspended nearly 100 times. It started at age 4 in preschool, linked to a bag of candy. And Cameron's profile starts off the story of how the BHC campaign, with its focus on community activism, has led to the passage of 11 new state laws to date. There's more pending. Uh, reforming school discipline practices to keep kids on campus where they can get help and guidance from adults rather than going out in the street and then they get exposed to the criminal justice system and they're on their way to a path toward incarceration. From 2012, when these first of these batch of bills were passed, and they're directly linked to this work, there's no question about it. Um, and to 2012, high school suspensions have declined 46% in California. That means annually more than 300,000 kids are staying in school, and graduation rates are going up. I don't have a statistic on that right now, but the chapter describes how that's a health issue because high school graduation confers a 5-year life expectancy increase over non-graduates. And this school discipline reform, it's a powerful success story. I think one of the most powerful in the campaign so far because of the scope of it. It's statewide, it's even heading out nationally. And it underscores what makes this work unique. The activists in the campaign don't concentrate on getting more doctors into poor communities or instructing people on better lifestyle choices. Instead, the approach concentrates on training residents to push back against denigrating forces, whether it's decrepit parks, unfair school disciplines, kicking their kids out of school, or allowing diesel spewing trucks in their neighborhoods. Now, this is an example of health promotion right here. This is on the steps of the state capitol. These are youth from the BHC site, and they're there to advocate for some of the school discipline reforms that are underway. You see the schools not prison hashtag over there on the right. And this is a meeting with a state senator, and it's an example of how, in fact, meeting with a politician to ask for his or her vote is indeed a powerful form of disease prevention in action. In fact, a highly powerful approach, but you wouldn't normally connect that dot. This is, and this is them at a state hearing. This is the Sierra camp that the endowment started, and this is for helping young men to heal from trauma and to develop leadership skills. And healing trauma is now a major theme of the work. It's something they learned on the way. They learned from the communities, and it was not initially a part of the plan. And that's another example of the advocacy and how that really ties into health promotion by promoting citizen engagement and awareness. And this is a skate park story, and let me get to that. This group in San Diego formed a team that began demanding a skate park. They had none in their area, but other wealthier areas had ample ones. They attended more than 100 city meetings and ultimately won the okay and funding for this park, a smaller one, as well as a 19,000 square foot one that just opened in January. And not only did they get a park to improve health, but this experience transforms those involved in the work. And the effect on young people who develop a new sense of control and power is phenomenal. And it also, of course, promotes health and reduces stress. And that's a common response I found in these communities. People describe a new sense of strength and the ability to shape their environments, and it lasts. And the idea is hopefully this becomes cultural. Their kids watch this, and it becomes more the norm in these communities to fight back and understand their rights. Now here's one of my favorite stories. That's Tootie Maher, behind a park that not so long ago had nothing but broken glass, dog fights. The swing set in the area was completely chewed up while dogs practiced biting on it. Kids would never go there. And she determined to turn it into a safe space for the community because she knew kids just had nowhere to go. And she did it through a number of steps I detail in there. Came a lot of hurdles. But she also, a key factor that makes this work in this very dangerous neighborhood. This is Iron Triangle. Everybody stayed away from it. But she's made that area safe now. By hiring local residents to design it and to run it. She pays them a good wage, they get benefits. She's brought economic stimulation into the community, but moreover, they live there and they're going to fiercely protect that park, because you do these renovations in parks, but then they fall apart because nobody's got any stake in it. And this is an example that Sandra can talk about in Fresno. They have an incredible parks plan where they have brought in revenue and opened up a great deal of park space in areas that never had it, as well as an extraordinary community revitalization plan that got a rendering plant to finally get out of their community. But this also shows Fresno is a pretty conservative area. We have some national politicians who are, well-known conservative politicians. So you see this is a 4-3 vote. And it just shows how community transformation often hinges on one vote. And it completely changes things. But that one vote swung it. And it also underscores the importance of citizen engagement. And this is another example of a type of health advocacy, urging parents to hold school districts accountable for fulfilling their promises. Now, how is that health promoting per se? Because if kids do better in school, they're more likely to graduate, and they'll graduate better prepared for college or career, which increases their income and sense of control in life, which translates to better health. So when you start this early on and make sure they have a good educational experience, it's enormous. So these small details matter. Here is Sam and Devone in the houndstooth hat, and Sam will be joining us. And they have started an extraordinary anti-violence prevention program in Richmond that's supported by the campaign. This is Rennell Robinson and Lavon Carter. They were once among the most lethal men in Richmond. But after joining the fellowship program, which concentrates on developing the potential of young men everyone else has given up on, they've become peace ambassadors. This is statistics. The bottom line shows 77% of those joining this program are not a suspect in a new firearm activity. Now, some people say, well, 23% are, but the point is 100% would have without this program. And it started in 2007. By 2016, there was a 71% reduction in gun violence causing injury or death in the community. So you'll hear more about that. And here is, and that's their group shot of them. Now this is an unlikely hero. This is Bill Lindsay in the front. Kimberly Acavez is another story, but she's a hero too. But Bill is an example. He's the city manager of Richmond, and it shows how the support of city leaders and bureaucrats greatly facilitates this work of health promotion and disease prevention. For example, Devone, who I showed earlier in the houndstooth hat, persuaded Lindsay to support his hiring ex-convicts for the new city-run anti-violence program, preferably ones with a gun charge in their background. As Devone said, can you imagine how the HR department responded to that? The city manager took a lot of heat for this support, but as Lindsay said in the, hold on, let me change page. He said, this is a quote from him in the book, "I'm a real fan of the Office of Neighborhood Safety. It's easy to defend, and I don't fear the soundbite anymore." This is Gary Peterson, another public official who's really quite heroic. He's a public works director in Salinas, California, who changed his mindset after the BHC campaign began in the area, and he's facilitated major advances there. Here's a quote from the book. This is from him. "The thinking now is, let's look at what the community wants," Peterson said. "I have to point to that as being one of the biggest changes in our thinking, for us to stop being the experts and to start listening to people and giving them actually what they want than what we think they need." This is Lisa and Lisa and Chris Howard. They live in Del Norte, the community up far north. And they're, as I said, the typical distressed rural community. They lost the logging industry. Fishing declined precipitously. And Chris once managed a casino, however, and he said it was an absolute nightmare to hire qualified people. They didn't show up on time. They lacked basic skills, sometimes scarcely literate. And there was a constant revolving door in an area of high unemployment to keep people staffed. And he realized if they had wanted economic revival in the region, they had to start with the school district. And so they started with the literacy campaign, which kind of did the typical thing of school tutors, and that wasn't working. And I describe in there an absolutely revolutionary new approach they're starting with deep, deep community engagement to try to understand the blockades to literacy that start at home, that start early in childhood, in order to truly promote literacy so that they're graduating college and career-ready students, in the hope that that will start local entrepreneurship as well as qualified employees for the businesses that are there. This is an example of the decline. This is the old growth, the sort of remnant of a closed lumber mill. And this is an example of, this is in Crescent City, outside of Crescent City, I should say, 20 miles north of it. But it's closed, so it's a food desert up there. They're working on a lot of food access work up there as well. This is the confluence of the Trinity and the Klamath River. That's right in the heart of Yurok country. So it's absolutely gorgeous country, but there is a great deal of poverty in that area, something like 70% unemployment. And this is an example of, this is Mackenzie Williams, who lives in Del Norte, and she became an expert documentary maker under a youth program work in the campaign. And this is an example of the youth media work that's heavily supported by this BHC campaign. This is Thomas O'Rourke. He's the tribal chairman of the Yurok tribe. To promote health, this is an incredibly unique vote in this campaign. Nobody would have expected it. But the tribe voted as its top priority to improve its own health, to begin controlled burns in its forest land, to promote the growth of basket weaving materials and traditional foods. And it's not something BHC campaign leaders had expected, but after reflecting on it, it made intuitive sense. And the tribe has now revived a robust controlled burn program to heal its forests, which it now entirely runs on its own, independent of the campaign. I met with O'Rourke in 2012 at the first burn site shown here, where a year earlier a controlled fire cleared away choking undergrowth that inhibited the growth of the prized hazel sticks used for basket making. This is a quote from the book. "We are very rich, and that's with the traditional way of life," O'Rourke said. "You get up in the morning, and you get out there on the hillside, and you start picking hazel sticks, and I've thought, man, it feels good to be alive, and you tell me that's not good for your health." And this is, I'll make this brief, this is described in the Good Eats chapter, how through work of the financing mechanism that the campaign and the endowment and on the larger scale supported. So this is in South LA that has never had a grocery store like this. So it's made a huge impact. This is a corner store work in Sacramento where they're trying to get corner stores to go healthy. They talk about the challenges. It really takes a supportive business owner. In this case, Ramon Cook is very supportive. But if the business owner isn't supportive, they found it has a really mixed track record. This is sort of an example of how these BHC teams work. They build these maps to describe where they want to go. And this is an example of a typical sort of action team meeting. They form action teams is how they do their work. And that's Sean Harrison, and which I'll note is a compensated position. And I think that's an important aspect of this work to discuss. And the Sacramento Food Team has had remarkable successes in passing new laws and changing practices in the school district, among other. They're very effective. Thank you.
Terrific. Wow. Thank you for kicking it off this way, Suzanne, because I think it really grounds the conversation in place. I don't know how many of you sat there thinking about the heroes that you've seen in your own work, maybe even thinking about your own privilege, as you may not live in a food desert, or you may not live in a place that has such limited access to safety, to some of the basic human needs. So thank you for grounding it in place. And also thank you for shouting out Del Norte County, because we're deep partners with the California Endowment in the work in Del Norte, and actually on the other side of our work at the Forum for Community Solutions, we've made over $300,000 of investment in a full-time person, helping young people organize for their own efficacy and for opportunity. So very cool to have that synergy. So I'll stop, even though you can tell I'm inspired by your introductory remarks, and I'll ask the panel to just come on up, all of you. And as I do that, let me do a couple of things. One is, come on up. Like, just because I paused doesn't mean you guys need to. Please, we're really excited to have this panel. First, let me just say to those of you who are watching, you can submit questions on Twitter using the hashtag @ChallengeInequity, and also on Twitter using the handle @AspenFCS, @AspenFCS. Panel, thank you for being here. Let me introduce very quickly John Auerbach, our esteemed moderator, who has a secret. He's married into the Aspen family, and I'm just going to leave it at that. And for my colleagues, I'll let you try to figure out the backstory on that. But John is president and CEO of TFAH, where he oversees their work to promote sound public health policy and make disease prevention a national priority. He's got a great 30-year track record in the public health space. For example, as Associate Director at the Centers for Disease Control and Prevention, he oversaw policy and the agency's collaborative efforts with CMs, commercial payers, and large health systems. During 6 years as the Commissioner of Public Health for the Commonwealth of Massachusetts, he developed innovative programs to promote health equity, combat chronic and infectious disease, and support the successful implementation of the state's healthcare reform initiative. As Boston's health commissioner for 9 years, I don't know how you survived 9 years as a health commissioner in Boston. He directed homeless, substance abuse, and emergency medical services for the city, as well as a wide range of public health divisions. So he's the perfect guy to moderate this exciting panel. So without further ado, I'll turn it over to John, and I appreciate your taking the time to be with us, John. Thank you.
Great, thank you very much. It's a pleasure to be here. By the way, the group that I'm now overseeing is called Trust for America's Health, and we look at the initiatives around the country that are really making a difference in terms of promoting health and prevention, and clearly this is one of those, and really a shining star. I would also say, encourage everyone to read the book. I finished the book just recently, and it is a terrific book. It's incredibly readable, it's very moving, and it's also not only interesting stories, it's really a guide for action for anyone who wants to do things in their own community. It's terrific. So Suzanne, thank you for that. The people on the panel are also major stars within the book. So you will, if you read the book after today's panel, you'll read all about them, which is makes it even more meaningful. So let me introduce the people who will be joining Suzanne in discussion. First, to my left is Dr. Anthony Eiton. Dr. Eiton is the Senior Vice President for Healthy Communities at the California Endowment. The endowment has started and oversees the Building Healthy Communities initiative. Dr. Eiton is well known within the public health and healthcare community as an incredible leader and innovator. He worked for 7 years as the director of the Alameda County Public Health Department and increasingly played a national role while in that position. Unfortunately, he's very much an underachiever. In addition to having a medical degree from Johns Hopkins, he also has a JD as a lawyer and an MPH. So whenever I'm with Dr. Eiton, I always feel, like I need to go back to school. So welcome, Tony. Next to Tony is Sam Bohan, and Sam Bohan is a key person in one of the chapters, chapter 6 of the book, that focuses on Richmond. Sam is the program manager for the City of Richmond's Office of Neighborhood Safety. Within that program, his key role is very challenging, and it really is a central, addressing a central issue, and that is assisting individuals who are either the victims or the perpetrators of gun violence. He also co-leads their Operation Peacemaker Fellowship program, and that identifies people within the community who may be at risk for violence, and he plays a leading role with his team at doing what can be done to reduce or eliminate gun violence within Richmond. In addition to that, he is a co-founder of the California Reentry Institute, which provides assistance to individuals as they're leaving prison. And then next to me is Sandra Celedon. Sandra is the Chief Executive Officer for Fresno's Building Healthy Communities initiative. She is a longtime public health leader within Fresno and in other locations. Among her past achievements was she was the Outreach and Enrollment Programs Manager at the Clinica Sierra Vista in Fresno. She also is in chapters both 2 and 3 of the book, where there's a good deal of discussion about schools and school policy, and we'll hear from each of those, from each of them. Suzanne, I'm going to start with you and just maybe just ask you an opening question, and that is, you know, you're an accomplished journalist. There are a lot of topics you've covered over the years. What about this? What about this grabbed you? What about this story, the work, made you feel like there's a book here and that needs more of a focus?
Yeah, it really tapped into a basic American value of democracy and voice and community engagement. So it made so much sense that after covering these topics for years and never really seeing the needle move, and understanding that it's lack of resources that is causing these, that truly the only way out that I'm beginning to see for these distressed communities, which are literally like third world countries. It's astonishing to be in these communities, and how could this happen? And that they have to get a seat at the table. They have to build up their political power, but they're not, it takes training to do that. You have to know how, plus there's been divisions within the communities. And also they're very busy. You know, they're working 2-3 jobs, they're stressed. So what this initiative does is really support them through, and I'll just give a couple practical examples of how you make this happen. You have community meetings where you provide a buffet dinner and childcare, so people can actually come out and engage. So you facilitate engagement in all manners, and that's just one small example. But I do believe that this holds the most promise for pulling these distressed areas permanently out. We've spent billions of dollars on these, and it hasn't really changed things. And this will be sustainable, I believe, I hope.
That's great, thank you, Suzanne. So Building Health Communities, which is the focus of the book, is an initiative of the California Endowment. And Tony, why don't you just begin by sharing with us, what is the California Endowment?
Sure. Good afternoon, everybody. So the California Endowment is the largest health foundation in the state of California. We were founded in 1996 by the conversion of Blue Cross of California to its for-profit status now, which is WellPoint. We're not affiliated with WellPoint anymore. We just got all their money. As a matter of fact, we and another foundation called the California Healthcare Foundation are essentially the beneficiaries of that conversion. And so we're about a $4 billion foundation, a little bit less. We spend just under $200 million a year with a mission to improve the health status of all Californians and to increase access to health care for essentially low-income Californians. Now, it sounds like a lot of money. California is a huge state. We've got 40 million people. On a per capita basis, we're certainly not the biggest foundation. And a point I like to make all the time, I used to run the Alameda County Public Health Department, which was part of an agency which spent $800 million a year in Alameda County, which is a county of 1.5 million people, which includes Berkeley and Oakland and places that you might recognize. So in government, the amount of money spent on health dwarfs the amount of money that foundations have. So our goal is really to kind of redirect how government uses its money. What we have is a little bit of flexible resources that we can actually showcase work that we think government should be investing in.
That's great. Well, California Endowment had supported a number of different initiatives, and building healthy communities was different. And can you maybe tell us what was different about building healthy communities than other initiatives, either at the California Endowment or other places in the country that had an interest in some of the same topics that Suzanne has highlighted?
Yeah, I think we may be a little bit different. I mean, in part, I think because a lot of us didn't come from philanthropy. You know, we come from government, from politics, from a variety of different areas. And so I think there wasn't a presupposition about how to improve health. And one of the things that, you know, I have witnessed in my public health career is that there's sort of this divide between those that think health is really an issue of essentially a technocracy, that there are technical solutions to health that just need to be implemented in communities. And those of us, I'm on this side, who think that health is primarily about democracy. And it's really about people's power, their agency, their sense of belonging, a sense that they can navigate communities in productive ways and pursue opportunity. And I think that this sort of like tension between technocracy and democracy is really what Building Healthy Communities tries to get underneath. Because we've invested squarely, we committed to invest $1 billion in building democracy in these communities and across the state of California, because we think that that is actually the most important lever to improve health across the board. And by the way, not just for low-income people. We recognize, and the data certainly supports it, that when you invest in the well-being of people's community health, their ability to participate, everybody benefits, including well-off people. And so I can talk a little bit more about some of that data if we get to it, but this is not just about low-income people.
So tell us just a little bit about the birth of Building Healthy Communities.
Okay, so in 2006, 2007, after the foundation had been around for about 10 years, I wasn't there at the time, but the board kind of, you know, had one of those sort of, okay, we're 10 years old, you know, what have we done, what's worked, what's not worked. And, you know, one of the things that I think that the board members at the time recognized, which I think many institutions, they go through this kind of existential moment and they try to figure out, you know, are we making a difference? Was that where there had been measurable differences made in the health status of Californians, it had generally been when there was an investment in not just increasing services or enhancing policy, but when it had been driven by community agency, people who had stood up and demanded change that led to the policy change that ultimately led to either services or what have you. And so, and in the case of the California Endowment, it had been in asthma and housing and a variety of related environmental issues where we'd seen actually an improvement in actual health status. But across the board, in a lot of the other measures, things had gotten worse. Obesity was worse, cardiovascular disease was worse, life expectancy differences had actually increased during the initial 10 years of the California Endowment. So the board said, you know, this is not working. We have to actually go big on, you know, what we have seen has worked. And so Building Healthy Communities was a product of this sort of recognition that these technical solutions were insufficient to this problem, that we needed actually more radical solutions. And so the idea was a 10-year initiative across 14 low-income California communities, spending $1 billion over those 10 years. And the only caveat was that we wouldn't spend a nickel on health care. So this was going to be entirely an investment in the social determinants of health. And that's what Building Healthy Communities is about. And I could talk a little bit later about, you know, how it's built around this notion of power and agency, both at the individual level and at the community level, but also this notion of changing the narrative of what is health and who matters. And allowing communities to humanize themselves, to share their story, to essentially create relationships across the state with other people who are similarly situated. And between power and narrative change, we think we get policy and systems change, which is more enduring.
Thanks, Tony. I mean, I would just underline something I think you said in passing, which is the California Endowment made $1 billion commitment. You know, I've worked with many different foundations who've really prioritized different issues and said we have to put a lot of resources behind this. I can't think of another example where $1 billion in a commitment and over a 10-year period with 14 specific communities was remarkable. And I think we'll return to that a little bit. But now we want to give you a little bit of a sense of what does this actually look like? Let's look at 2 of those different communities, the 14 communities, to get a sense of what happened in those communities when the California Endowment selected them as being sites for building healthy communities. And Sandra, let's start with you. So in Fresno, give us a little bit of maybe the history that was going on that was relevant to the work that the California Endowment ended up supporting through building healthy communities, and what did that look like?
Yeah, I think for Fresno, at the same time that the California Endowment was kind of starting this process of really evaluating the impact, there was already work in Fresno happening that community organizations, community-based organizations were leading in regards to access to care and really advocating for folks that have been disenfranchised. And what was happening around that same time between 2005 and 2007 is that community groups were actually already convening to have this discussion about we're actually not making a dent, right? So we know that Clinica Service is providing healthcare. We know that California Rural Legal Assistance is trying to help immigrants, and all of these different community-based organizations are in our community, and we're all doing all of this work, but we're not seeing the impact that we should be seeing based on all of the staff time and all of the resources that we're allocating in our community. And so there was already conversations happening at that time, and I remember at that time we actually had what we called the Patient Care Coalition, right? And so most of us came from this service delivery model, and so we were talking about how do we make sure that patients get the care that they actually need in order to be healthy. And so these conversations at some point then really kind of merged, and we started to think about how do we start breaking out of these silos. And so through those conversations, we were able to then really advocate for Fresno to be selected as one of the sites, because at that time, the California Endowment was looking at communities across the state, and we knew that there was only going to be 14 communities that would be selected. And so it really was kind of our first joint effort as a coalition, informally, right, to be able to advocate for our community based on the fact that we knew that there was a huge life expectancy gap within our community. Southwest Fresno 93706, which is a predominantly historically Black community and now is an immigrant community comprised of Latinos, Southeast Asians, is one of the communities where 90% of our heavy industrial uses are housed, right? This is the community that was redlined, where African American folks in our community weren't able to purchase homes outside of this neighborhood, right? It got its first grocery store in the late 90s, right? It scores as the most heavily impacted community in the entire state of California. And then we have about 17 other census tracts within our city that actually score as the top out of the top 20. And so there was these conversations happening. And so as the endowment engaged in this 2-year planning process, right, once that Fresno was selected, we were able to really set the foundation for the framework. What are the issues that are important not only to community-based organizations, but in reality to residents, right? And so this really elevated the issues of land use. And what we kept hearing from residents, I think was interesting at the time, was it was about dog control, right? Like we have all of these loose dogs in our community, and they're like, we can't walk, and it's not safe, and there's no infrastructure, and we need housing, and all of these things that we were like, okay, how are we gonna help folks address all of these really big issues? We just wanted people to have health care, right? And so we really had to change the way we were thinking about health. And I think the partnership with the California Endowment would have allowed all of the community-based organizations to really look at was social determinants of health, right? If you weren't in the public health field already, this was a new concept. And so it really helped introduce this concept to tie in all of our work and be able to have a common language that then we can work out of. And this is how the initial priorities between 2008 and 2010 were really developed in partnership with community residents. And so I remember those meetings where we had 300 to 400 folks and we were meeting on a routine. I think we got like meeting to death, right? But it was really about having these conversations about, okay, what is important to us? What are we going to work on together? What are we going to do for the next 10 years? And I think the fact that we knew that the endowment was coming in and a 10-year commitment really allowed us to be visionary, right? Traditionally, we were planning in 1 year, 2 year time lengths, but 10 years, we really thought, okay, like we can actually do something, right? I think back then we thought we're going to change the world in this next 10 years, right? And so what we've learned is that we've actually just begun to shift that, right? But I think it definitely was this meeting of community groups and community residents being ready for meaningful change, and then somebody like the endowment to be ready for investing in meaningful change. And that's really what helped us create Fresno Building Healthy Communities in partnership with all of the other sites.
So, you know, what occurs to me that was partly different about this in your experience, and I think in the 14 communities, is often when philanthropy or government gives a grant, it's for a particular topic. It's, you know, work on heart disease or diabetes, and then you apply to say, here's what we're going to do, and maybe we'll even do what you told us to do in the application process. Mm-hmm. This wasn't like that at all, right? So what was different about this, and also what arose to the top as the issues that you were going to deal with?
Yeah, I think that's part of the conversation, right? So what was happening, and I think what happens traditionally in when you look at traditional funding models, is that organizations or funders fund organizations to work on very specific linear issues. And so what that actually creates is kind of this twilight zone where you're ignoring everything around you and you're just like, I'm just focused on making sure you eat 5 fruit and vegetables every day, and that's it. Yeah. And we're ignoring the fact that there's no grocery store near you, or we're ignoring the fact that there's like 20 loose dogs outside of your home and you do not want to walk out there, right? And so I think that conversation with community-based organizations, we were starting to break out of our silos slowly and recognizing that if we wanted to make sure that folks had health, we had to make sure that they lived in communities that supported those healthy choices, that made the healthy choice the easy choice. And what we were hearing from residents is that that was not actually the reality. And so as we started to have these conversations, it really elevated, at least in Fresno, this idea of land use, right? And so what happened at that time is we were hearing about the dog control, about lighting, about parks. We were hearing about sidewalks. We were hearing about housing. And we thought, how do we address these issues so that we're responsive, right? Because the other problem is that sometimes that we were seeing is funders come into an area, right? They give you some dollars, you do a project, you wrap it up, you submit your report, and then goodbye. And residents really spoke against that. Mm-hmm. That was not what they wanted to see in their community, right? Mm-hmm. They were like, look, don't come into my neighborhood if you're not actually going to be here for the long run. And I remember very vividly at that time, there was this concept, this buzzword of resiliency. We're going to build resilient communities. And residents were like, what do you think we've been doing this whole time? Like, we don't need to be resilient. We're already resilient, right? We actually need to build power. And that's what we recognize, right? Residents understood that when they went to City Hall, when they went to the public health department, whatever body that they were interacting with, they were being ignored. And so they're like, how do I make myself visible? That was really what residents were telling us. Mm-hmm. And so that really shifted the way that organizations, community-based organizations, started thinking about it, right? A lot of us were like, oh, well, we can't do civic engagement. That's like not in our work. So we really had to rethink about what does it mean to build advocates and be advocates. And so at that time in Fresno, the beautiful thing I think was kind of the meeting of the universe is that the city was undergoing a general plan update process. So a general plan typically designates land, future uses for zoning, right? Where is housing going to be? Parks, where are we going to build our business corridors? Where are we going to put all our heavy industries and things of that nature? And traditionally in Fresno, right, this is the area where there was Operation Rezone, right, with literally developers would walk into council members' offices with bags of money and say, zone this area for this use, and here's your bag of money. And folks ended up going to prison for this, right? So this is the history of Fresno. And so traditionally, nobody engaged in the general plan process besides developers and elected officials. And so at that time, as we were kind of thinking through, okay, how are we going to respond to what we're hearing from residents? And we were like, the general plan is due for an update. And it really dictates how communities are built. We really need to look at that. And so we had to go back to the drawing table as advocates and say, okay, we have to master and understand this general plan process and then engage residents around this. And that set the tone for the next 10 years.
That's great. That's great. Let's shift to Richmond. And Sam, you've had, in your experience, the Office of Neighborhood Safety is not a Building Healthy Communities organization per se. It's a partner and has been involved with that. You're a leader within the Office of Neighborhood Safety. Tell us a little bit about how you got involved, and then we'll move to the specific work that took place in Richmond. So tell us about your involvement with the Office of Neighborhood Safety.
Thank you. Richmond has been historically violent, averaging 40,
Is your mic on?
40, 45 homicides a year, predominantly black, mostly African-American males under the age of 25 have been the victims. And it was the forgotten, it was the untouchable, so to speak. And every urban community knows this over years and years. The war on drugs, gang injunctions, all of these types of things to try to solve the problem. All it did was victimize our community even more. And we are still there in 2000, in the early 2000s. So, I'm sorry. There we go.
Okay.
And so I was a product of that environment. I was a victim of that environment. I was a perpetrator in that environment. And in San Quentin, there was a bunch of gentlemen from Richmond who mostly were in there for murder. Most of them were lifers. And most of them were seeing their sons, their nephews, their brothers get killed, watching the news every night. And we said, I mean, something can be done. We have to be able to do something. So we started a group of folks in Richmond brainstorming on how we can help from our circumstances and our situation. The city council and the mayor were also looking at ways to solve this problem, ways to try to figure it out, ways to help the community. The squeaky wheel gets the grease, as they say, and the community was in an uproar, like they were tired of burying babies. So a group of folks from the city council and the mayor and Mr. Bogan, who was a consultant at the time, came into San Quentin where I was. They wanted to hear our ideas. They said that what we said was important, which was very rare. And they started this organization, the Office of Neighborhood Safety. I was released from prison 2 months after the office opened, and I spoke at an event not too long after that, and I've been working with them ever since, going on 10 years now.
So tell us a little bit about how that work has linked up to the Building Healthy Communities work in Richmond.
So most people think that the young men that we serve is the actual problem. Our argument is they're a symptom of the greater problem. And Building Healthy Communities is trying to create a holistic approach to what health really means. You might have great arteries, you know, you might be the
Top monkey.
you might be the monkey that got all the power, but it doesn't matter if you can't walk to the bus stop without getting shot just because you're a young black man living in a community it's a war zone. And so trying to help folks realize that everyone has to be a part of the solution, it's difficult. It's a moral dilemma. Like they do inhumane things, so we treat them inhumanely. Our argument is what came first, the chicken or the egg? Like, how did they become this way, and who's gonna hold themselves responsible for that? And so we help them realize, yes, you are a victim. You've been victimized, you've been ignored, you've been traumatized. You live in a community that you feel like doesn't even care about you. Schools failed them. A lot of the times their parents failed them. The communities failed them. They become invisible. And so, I mean, imagine what you would do if you had the cloak that no one can see you. As a healthy person, educated, sophisticated, what would you do? What would you actually do? And so these young folks are doing all that under the guise of invisibility because no one sees them. And so they matter when they feel like they're protecting their community. They matter when they feel like They're solving a problem that nobody's solving, because if you get killed in urban America and you're a person of color, more than likely no one's ever going to go to jail for it. And so how are we going to stop folks from coming into our community, harming our brothers, our cousins, our parents, our family? We're going to make sure they realize there's a consequence to that, and that most violent communities are the safest. Because if you come in here, we're responding drastically. You take one of ours, we're trying to take 4 of yours. And we're gonna tell you, you better keep scope. It's easier to go over there and deal with them. And so getting folks to realize that there's no such thing as health if everyone isn't healthy. I mean, who leaves a spoiled apple in a bunch of brand new ones? It's contagious. And so we wanna make sure that these folks are identified as part of the solution instead of just the disease that you're trying to cut out.
So give an example of what you'll do with working with someone around the notion of healing and belonging.
Well, first of all, you're important and I love you. I mean, it's a basic concept. For some strange reason, it seems foreign to everyone. These young men are part of the community. They are our children. They're our babies. And for some strange reason, they've been forgotten. So initially, it's just, I see you. Build a relationship with you. Let you understand that it's an important relationship. Like you like it just as much as I do. We get on each other's nerves constantly, but what good relationship doesn't have friction? But just helping a young person realize, first of all, you're important and you matter, and you mean something to me even if you don't mean something to yourself right now. Realizing that there's beauty inside of every individual, and everything that they do has somehow been transposed onto them through situations and circumstances. Help them realize that they can have a future. I was looking at the PowerPoint of the age, 73 and watch. Like, these youngsters would love to make it to be 73. Most of them don't think they're gonna make it to be 20, which is why they don't care about going to school, which is why they're not worried about having a soft skill and job skills. They're living day to day. You can give them $100,000 today, they'll be broke in 2 months. They're just trying to enjoy it, because who knows, I might not make it to 3 months. And so just helping them realize that they can't see a future, letting them realize you do have access to resources, making sure those organizations that is getting the money that Sandra was talking about, for all the statistic these young people are making, make sure it kind of reaches them and not just above them and everybody else around them. Making them realize we're not gonna let you be invisible anymore. Working with them through a life map, letting them get a hold of healthy individuals, healthy men that look like them, with no ulterior motive whatsoever. We want you to be okay. I have no hidden agenda, which is rare because everybody wants to take advantage.
That's great. Now, Suzanne,
just wanna say-
chapter 6 is all about this,
Yes,
the work in enrichment, so yeah.
Yeah, I just want to say there's an incredible story that's in the book of Sam Ronell Robinson. I showed in there they're all active firearm shooters. That's who gets recruited. They're known for being shooters out in the community. And Sam, he called him up. One time he had a desperate point. He had no money. Somebody had been shooting at his car. And he said, he was feeling like, I got to do what I got to do. And then he's called Sam at 1 in the morning and said, Sam, I got to talk. And Sam said, I'll be right there. We'll meet for a meal. You met him at a restaurant. And that transformed him. He said, he cares. Nobody ever shows up. He actually showed up. And I have never had anybody show up like that. And that made me realize they love me and I'm going to make them happy. So it's that kind of support that they don't get anywhere else.
So I would just say, I mean, I think we've seen just from those 2 examples of Richmond and Fresno, the work of building healthy communities is really different. It really comes out of the community's identified needs and what the issues were in the community. And Tony, maybe just to give us a little bit of a sense, I think are we in year 8 now of the,
Yeah.
and as you've reflected on it, as you've looked at the impact across the 14 communities, has it worked? Is there evidence that this kind of approach, this indirect approach to improving health by and empowering communities to decide on the issues and work on those issues, has that resulted in some outcomes that are positive outcomes you can point to?
Yeah, well, I mean, you've clearly heard about some of them. I mean, this is the easy part of my job, which is to describe what's changed over those years across the state of California. And Suzanne pointed to some of it. You know, we didn't agendize school discipline, for instance, as an issue in building healthy communities. We brought a kind of a loose agenda around the social determinants of health and brought it to communities, and then we kind of engaged in this dialectical process with communities, trying to figure out what made sense to them that fit with the things that we thought we were charged to do. And we got a lot of push. It came actually originally from Fresno on school discipline. They said, stand with us on school discipline. And we said, for 2 years, we literally said, no, we don't think that that's a health issue. We're not an education foundation. We think it's an important issue, but we don't know enough about it. And they kept pushing us till finally we actually started doing some deep research on the issue, and we found out that there were 800,000 suspensions and expulsions in California every year, way more than the number of kids that graduated. And then we got into that issue, and we helped organize our sites around that issue. And Suzanne pointed out, we've cut school suspensions and expulsions in half in California since 2011, 2012. And that includes for African American kids, Native American kids, the kids that are disproportionately suspended. And in some of our sites, those numbers are approaching zero. So, we point to that. That's one of the lovely thing about it is that it wasn't on our agenda. Our communities put it on the agenda, and it's very measurable. You can just count it, and you can just see this dramatic decline in suspensions and expulsions. Mind you, at the time where other big states, Texas, Florida, New York, are not seeing that. So California is very unique in this particular trajectory. But we also had the serendipity of having the Affordable Care Act get passed, roughly around this. We didn't know that was going to happen. We were delighted when it did happen, and we actually helped, through Building Healthy Communities, invest in the outreach for the Medicaid program in California, and we helped enroll. We are actually the sole funders of Medicaid outreach in California. We enrolled 4.5 million people in the Affordable Care Act, so that was clearly measurable. We also participated in changing some of the kind of the laws around formerly incarcerated people. So there's this proposition called Prop 47, and subsequently there's this thing called Prop 57, which allowed people with low-level felonies to reclassify them as misdemeanors. And so they don't have to check the box on employment applications or housing applications. And there are 1 million people in California now that don't have to check the box. And that's one of the results. We also were able to facilitate, through another campaign that Suzanne pointed out, Health for All. 280,000 undocumented kids are eligible for full-scope Medicaid in California as a result of that campaign, and we're pushing for adults as well. So we have measures across the board that are, objectively, discernible, that are the product, not of us. It's really of us facilitating community to advance the issues that they choose to prioritize. And when community does that, you see remarkable things. Our board has basically said to us, well, we're getting to the end of 10 years. Let's tweak this thing and go another 10. So that's kind of what we're in the process of doing right now. I do want to touch on just one theme that sort of runs through all of this, which is, we live in a post-apartheid country. And this whole notion of race equity is squarely at the center of our work. And what we've recognized is that, and the literature supports us, is that agency, power, control, the sense of the ability to get things done as an individual or as a community is good for your health. We also recognize that this notion of belonging, being seen, not being invisible, being heard, having a voice, having your story told, being able to tell your story is critical to your health. So we invest literally with all of our grants in trying to explicitly figure out how are we building agency, how are we creating a sense of belonging? And that came to us from community, primarily through the trauma work and the healing work that's necessary to deal with trauma. So we've learned an enormous amount working with communities because community has the answers. We just have to figure out ways to sort of allow those answers to rise to the top.
Suzanne, tell us, do you have a favorite story that maybe illustrates some of the outcomes of the successes that Tony was just mentioning?
Yeah, I mean, I showed you Tootie Maher, and I think that's there's so many good stories. It's really hard to choose, but she shows the determination. This is grueling work sometimes, and it's tedious work sometimes, because you're talking about overcoming bureaucracies. And but in her case, for example, to get that beautiful park, which you know, I can't describe the transformation of that community as a result of that, and how kids are now getting out. She described when she first got to that area, just looked at this decrepit park, she heard all these distressed sounds of kids screaming, or kids crying and screaming, and parents shouting because the kids couldn't go outside, and how much she understood kids needed healthy development, how critical that was to their cognitive development. But what she started with was, there was a drug house across the street, and that was the source of a lot of the problem in the park. So she had to work for at least a year, probably longer, with the police department, with the city manager, public works, to get that thing shut down. So and then also there were a lot of boarded up homes, so she managed to get some HUD money in there. She worked with the city, and they got HUD money in there to restore those homes. All those homes are now opened up. And she also had to, this is critical to this park happening, she had to convince the city manager, again, our enlightened Bill Lindsay, to give her a sole source contract. You know how you have to bid out, that's the rule. But if that bid out, then it meant some contracting company in, you know, a community 50 miles away would get that contract. They would do the job and they'd leave, and then it would fall apart again. She knew she had to get a sole source contract, so she managed to do that. And then she transformed it. She realized, I have to get resident engagement. So she hired all these locals, many of whom had never had real employment before. She got them training and skills on welding, and, you know, and so they got all these skills, and now they're running it. So, you know, and then at last count, I believe she's pulled in about 16 million in grant funding for these various projects. So it's thinking outside the box in that way, and it's being very, very persistent. Another interesting issue, these are the population that's working for her. There were conflicts between them. There were sort of black-brown, sometimes tensions, and she said she felt it was all going to fall apart. People told her, you can't get residents in this area to work together as a team. So she ended up, really thought it wasn't going to work, actually. So she brought in a counselor. She goes, this righteous African Americans, as she described it, who sit down, and she goes, any trouble comes up during the week, save it for Bill. And then they all go talk with, and they managed to keep the group coalesced. So it's those, without that, it might have not worked. So it's those small steps that it take to transform.
Yeah, I would say one of the wonderful things about the book is it describes each of the community activities in all of its messiness. Yeah. That things weren't always easy, that sometimes there was conflict, sometimes there were obstacles, and either the community came up with solutions to those, or I think in a number of cases, they talked to folks at the endowment who said, well, can we help you in some way that will complement the work that you're doing, maybe with a media campaign or some legal assistance, or that kind of synergistic relationship, I think, that you didn't just fund the communities and then say, figure it out on your own. It sounded like the California Endowment stayed involved and looked at ways as issues came up to help. Well, we can keep asking questions up here, but we wanted to leave time for you all to join the discussion. So this is an opportunity for you to ask questions of the people on the panel or ask questions of Suzanne about the book. So yes, please. And introduce yourself as you ask a question, please.
My name is Yasmin. First of all, thank you to the Aspen Institute for hosting this important and timely discussion. Dr. Eitan, thinking to community and belonging as concepts made me reflect on the paradox in public health called the Hispanic paradox. And the fact that despite negative environmental variables, we know that Hispanic communities, their survival, but sadly that benefit that they had loses over time. And I wanted to ask, in terms of your interventions, and then there's been so much more domestic research since then. There was a meta-analysis of over 400,000 people that showed that positive relations, to your point, Sam, social cohesion, positive relationships had a 50% impact on survival, not just quality of life, but survival. How in a program might you want to sustain, mobilize, leverage, and quantify that? And then the second question I had was for Sandra. Sandra, I really like the way in which you frame the community conversation about resilience and power. Could you speak a little bit more to how, to growing women's agency within that environment and the role that women played?
Great.
Yeah,
Tony?
great questions. So just for those of you who aren't familiar with the sometimes referred to as the Hispanic immigrant paradox, it's just an immigrant paradox, quite frankly, and that is that immigrants are healthier than native-born Americans across the board. This is Latino immigrants, this is Asian immigrants compared to American-born Asians, this is African immigrants compared to African Americans. And as they acculturate, their health gets worse. And we've taken to saying that America is not good for your health. But you see this successive worsening of people's health status as they become more American. And so what's the lesson in that? The lesson is that we need to understand why immigrants stay healthy. What is that sort of buffer that they have that allows them to live in very poor communities and actually have fairly good health status? And we recognize that part of that is this notion of social cohesion. I mean, immigrants, well, there's a number of different things that we know that are different about immigrants. Immigrants they're very motivated. They come here to work and to better their lives and the lives of their children. So they're very hopeful people. 2, they tend to eat more traditional diets and less of the sort of processed American food. 3, they form very tight social networks. And the communities tend to engage in what our president rightly refers to as chain migration. People come from the same place to the same place, and they form these tight bonds. And then over time, as they acculturate, that starts to break up. And they become sort of, perhaps for the first time in their lives, exposed now to racism and discrimination. And they're now becoming more American, so their diets get worse, and their social relationships break down. So we've tried to learn from that experience to how do we design interventions, if you will, that foster a much deeper sense of community belonging. I'll give you one example of one of the things that we've done, which actually Alex, my colleague, oversees. We've actually invited the communities to actually put together a graphic novel to tell the story of their experience in that community. So the African American community will talk about how they came to Sacramento, as will the Latino community, as will the Hmong community, which is a Southeast Asian community, and they've put this all together into a story, a graphic novel, which they then distribute around the community. So people hear that collective story and they see their journey and other people's journey, and it creates this sense of belonging. And that's just one example that we try to use to try to learn from this notion of how do you build and maintain social capital as a health investment.
Sandra, women and agency,
Yes.
the concept of agency.
Thank you for that question, actually. I think one of the biggest benefits that, from my perspective, of the partnership with the California Endowment is this concept of changing the narrative, right? And so we've known that there's been this work happening in some form or fashion in all of these different places. The challenge that we had in Fresno is that a lot of our work was also invisible. Not only are the people that are predominantly people of color and immigrant communities, because Fresno's a farming town, right? We're agricultural Central Valley. A lot of folks that live in our community are farm workers or work in packaging warehouses and things like this. And so what we were seeing is that we didn't know how to tell our story, right? Or we didn't have the microphone. And so the partnership with the endowment, I think one of the biggest benefits from my perspective is the communication support that came with it. But it wasn't just about the hashtag, right? It was about creating this narrative to counter the tale of two cities, right? And we see that across the country in cities, right, where it's either west or east, north or south division, right? So in Fresno is north. So if you're in North Fresno, you're going to be most likely a white Fresnan, pretty well off. You're most likely going to be somebody who has access to your representatives, access to decision makers, right? And you're most likely going to be the community that doesn't have the diesel trucks going through their neighborhood, right? I think Suzanne mentioned earlier an example of a community. Well, Fresno just had this, just a few weeks ago, right, where a very affluent white neighborhood was opposed to a parking lot being built near their neighborhood that would allow access to the river for Fresnans, right, because of the added on traffic. And so they went down to City Hall, right, made a ruckus, and of course the mayor came out and said, no, I oppose this. And then the San Joaquin board was like, okay, we're not gonna do this, we're actually gonna do this other $3 million additional add-on to reroute traffic so that it doesn't go through this neighborhood. But just a week prior, they had approved adding another industrial facility in South Fresno with a projected 6,200 daily diesel trucks going through this neighborhood, in spite of over 300 community members showing up and saying, we do not want this, right? And in spite of community members saying, you have not done an environmental impact review. So these are the things that we're talking about, right? But where the benefit of that is that we now have the microphone, right? We've changed the narrative to create one healthy Fresno. And so our tagline really is the response to the tale of two cities. And so what we're saying is the answer to this tale of two cities is one healthy Fresno. And how do we create one healthy Fresno? What is one healthy Fresno? Where it's a place where all children and families can live healthy, safe, and productive lives. And how are we gonna get there, right? And so we talk about the story of sharing the story that's happening in our neighborhoods, the organizing work, and the many leaders. And so what we've also looked at in Fresno is that we recognize that, one, Fresnans are young people, predominantly under 30, right? Typical average Fresnan is gonna be Latina, 30-year-old single, no children. That's who a Fresnan is, right? And when you look at the county, it actually doesn't change much. The age goes a little bit up, 32, but it's still Latina, single, no children. And so what we kept thinking about is, how do we make sure that we're representing the folks that are in our communities, right? So South Fresno, where we do all of our work, is predominantly people of color. 72% of the folks that live in South Fresno identify as Latino, right? And then followed by Southeast Asian, predominantly Hmong folks, and then African Americans. So when you combined all of the population in South Fresno, 92% identify as a person of color. And so we wanted to make sure that our coalition was reflective of this. And so our coalition, when we look at our partners, who are our organizations and who do they represent? They represent the 92% of Fresnans that live in South Fresno, and they're also primarily led by women. And so what we have done over the years, and it wasn't always so, right? When Fresno Building Healthy Communities started, the hub was led by a man, right? And so what we started, and we have a lot of investment as well, because of the fact that we recognize that young men in our community were being disenfranchised through the school system, right? Dr. Ayton alluded to this earlier about when we were kind of setting the stage for our agenda, between 2008 and 2010. I remember in 2009, young people came to us and they were like, you guys really need to be talking about how we're getting kicked out of school. And so we were like, what are you talking about, right? And so they're telling us, well, we're getting expelled for things that rolling my eyes at the teacher or, being a teenager. And so we remember, Sarah Reyes, who works for the California Endowment, right? We went to Sarah and we're like, we're hearing these things and we really don't know how to address it. And we need to have this deeper conversation. And so Sarah, took it to the board, to the TCE board. And this is how, and we put young people in front of the board and we're like, you really have to be able to share your story and talk to folks about what's happening. And so they met with the board and the endowment, after some time, responded. And we saw this as well with the Health for All campaign, right? I always kind of give a little dig to the endowment. I'm like, don't forget, you weren't always about health for all, right? And I think when we started, it wasn't that they didn't believe in health for all, is that when we started, they had a very central focus about, we're just gonna enroll people into healthcare, and we think that's gonna be transformative, and it is, right? But advocates on the ground, at that time, we were saying, what about the folks that are left behind? Because we are a farm community and we know that at least half of residents that live in our community are undocumented, they're not going to benefit from the Affordable Care Act or from Obamacare. So what about them? And we were already having these conversations, right? And so we really pushed, and I remember I think that's another story that gets lost in the conversation about how the Building Healthy Community sites have been able to organize with each other, and we have conversations outside of the endowment to say, okay, when we all meet, this is what we got to talk about, right? And this is how we've pushed this system, right? Because in essence, this is a system that really has helped set the tone for the entire state of California, and I think even the country, right? And how advocates and community members have really been able to shape the agenda, and I think that really speaks volumes to the endowment being responsive. But going back to women. So what ends up happening is the endowment, they developed the Boys and Men of Color Initiative, right, which kind of goes hand in hand with Building Healthy Communities. And it was a response to all of the different stories that were shared with us about how young men were being targeted, whether they were being kicked out of school, police targeting, all of these different challenges that young men experience. And so there was a very, very central focus on building leadership with young men. And what we kept hearing in our side in Fresno is what about the women? Well, what about the women? And we stopped to look and we were like, you know what? When we look at who's doing all the work, it's all the women, right? I mean, we have Sarah Reyes, who serves as, at that time was the program manager for the endowment. You know, we now have Sabina, who at one point was at Communities for a New California Education Fund, doing civic engagement. We have Veronica Garibay over at Leadership Council on Justice for Accountability, who wrote the bill that created the Transformative Climate Communities Program, right, who helped co-sponsor that, which then allowed us to draw down $70 million to Fresno, right? And so we really started to think about, we have to highlight the women that are doing a lot of the hard work, not only in front, but also behind the scenes. And so when we talk about Fresno building healthy communities, we talk about the fact that we're women-led and we're people of color-led. And if you support these two values, then welcome to our coalition. And so that's what we're doing. And so what we ended up doing then 4 years later is we launched in Fresno the Women Empowered Group. And so Women Empowered really serves as the partner to the Boys and Men of Color work, which is about investing in young women and their leadership, starting at age 13. And so that was something else that really came out of Fresno, which then traveled to all of the sites, and really making sure that we're highlighting the role that young women play in our communities, and that we're investing in young women, and that we're also creating space for young women to be visible and share their power.
That's great. Oh, that's great. Thank you, Sandra. Yes, gentleman there.
Hi, my name is Reggie Tucker Seeley. I'm a faculty member at the University of Southern California, and also spending a year here in DC as a Robert Wood Johnson Health Policy Fellow. So I appreciate the point around sort of that poor communities don't necessarily have a place at the table. Did it help that the California Endowment was the name on the chair that got them to the table? And what are some of the things that you helped communities do to make sure that they can stay at the table and communicate it to policymakers in a way that actually facilitated change? As a researcher, we'd like to assume that evidence sort of moves policy decisions, but just because we know what to do, that doesn't mean we always do it.
So before people answer, I just want to do a time check. We've got about 10 minutes and a lot more questions. So I think to the panel.
You want to take a few more questions, maybe? Collect them?
We could do that. We could do that, and then we'll try to answer as many as we can in terms of the time that's left. So let's do
that succinctly.
Okay.
Yeah.
Go. Let's.
I could just
take it
provide.
on.
Certainly, Dr. Aitan will have a perspective too, but simply, in my perspective, yes, having the California Endowment definitely gets more attention. They know there's some heft behind it. And the practical implications of that is the endowment can step in with data. Like, for example, with this skate park story I described, the real thing that pushed it over the edge was they funded a health impact assessment in which researchers combed the existing data, peer-reviewed data, to show how skate parks could lift health. That convinced the city council to finally go through with it. There's polling data. So those are the kind of practical supports that make a huge difference. Does that answer your question? Okay, great.
I would also just like to add to that.
Please, Sam.
Because the seed money from the fellowship, the first dollar that we got to be able to put into these young men's pockets, to be able to take them around the globe so that they can see something different, so that they can understand life is bigger than their community, was given by Dr. Aitan to our office. And so when everyone was saying, you done lost your mind, why are you partnering with these folks? He was saying, you know what, let's invest in them.
Oh, that's a great story. Sam, thank you for adding that.
I think to add just really quickly, how do we, definitely, yes, the endowment helped open the door. I think the challenge is how do we stay in the place, right? And so one of the things that I think we've built, and we've done a really good job as building this expertise, this technical expertise, right? So what you see across the sites is you have community-based organizations that now house expertise around land use, expertise around school discipline, right? Knowledge is not going to go away. And it's not just in community-based organizations, but it's also in residents, right? And so this is why we're able to pack council chambers, right? With 300 people, 130 people show up for our community action days, whatever the case may be, is that folks are belonging, right? But they also have something that you can't take away. And that's the expertise.
Yeah, that's great. So we're going to do I think we'll do 3 questions in a row, and then we'll get the panel. Okay. So gentleman over there. Yes.
Several days ago, the New York Times ran a front page story, a long story about how Richmond was the second highest eviction rate in the country, and several area cities, Norfolk, Hampton, Newport News, also were in the top 10. What is it about Southeast Virginia area that causes such high eviction rates, and how does that affect the mental health of those who live in that area?
Okay, that's a great question, and I think that will apply, but it's a different Richmond.
Yes.
Hold that thought. Next question.
I'm sorry.
No, it's a relevant question though, in spite of the geography. So yes, to the lady in the blue.
Yeah, hi. I'm Cheryl Gray. I just retired from the World Bank. Thank you. First, I want to thank you all. It's very inspiring and wonderful to hear. All of your stories are just great. My question, I was very interested when you talked about Obamacare and something the federal government did that made such a huge difference for health in low-income communities. I guess I'd be curious, given that you're at the right at the community edge, to hear your perspective on, has there been anything at the federal level in the last year that you really have seen making a big difference on the ground where you are? I mean, obviously our government's changed very much at the federal level. Are you seeing the impact? Is it major change? Is it a minor change? And in what areas is it having an impact, if at all? Thanks.
Great, thank you. Yes, in the back, the gentleman.
Bob Griss with the Institute of Social Medicine and Community Health. This whole program is really demonstrating beautifully the value of democracy for health at the community level. But I'm wondering how these lessons can be transferred to regulatory authority at the state level and at the federal level, when civic engagement is really not what's driving the resource allocations. Tony mentioned that this is a great example of how we can use community engagement to redirect resources. But the economy has its own logic. And I'm not hearing strategies for challenging the logic of the resource allocation at higher levels that really shape the poverty in the communities that you're talking about.
Great, thanks. Well, we've gotten a few different questions, from sort of what leads to high eviction rates, what's the impact of Obamacare on the street level, and then can this translate to a state or the federal level? I open those up to, why don't we just go down the line here, and each of you answer whichever question you want. So Tony, starting with you.
I'll try to touch on those two. We're talking Richmond, Northern California, which is struggling also with evictions and the stress that's associated with that. But let me try to touch on these two first. So Obamacare was huge, unexpected. California delivered more enrolled people into Obamacare than any other state by far. And while we think that people getting access to health insurance is important, we think that the data suggests that it's only about 10% of what actually impacts health status. But we think that that sense of belonging, that sense of actually being able to participate in the system, is actually probably as valuable, if not more valuable, than the actual health care that's associated with the Affordable Care Act. Since that time, because I think your question was, has there been anything else at the federal level? The answer is yes, and it's all negative. It's really, we actually stood up this new fund we call the Fight Fund, and it's basically to resist what's happening at the federal level, across all of the fronts that you all are very aware of. So the answer is that the primary impact has been on terror in undocumented communities in California, and amongst some of our formerly incarcerated populations, with these new kind of draconian threats coming out of the Department of Justice. So we're having to shift resources to resist and fight rearguard actions on things that we had accomplished in California. The good news is that the narrative in California has kind of stably shifted to a narrative of inclusion. So we see the populations that the federal government is targeting as being central to the well-being of our state. And that has informed policy, and that has improved the conditions, and has brought people together across their respective issue areas. So there is a silver lining to being attacked, and that is that it it forces people to create solidarity and to consolidate some of their issues.
And Tony, what I would say is don't answer Bob's question, because I think the final question I'm going to ask each of you when we finish this round is what have we learned from this experience that is either replicable somewhere else or transferable to a different setting? So let's hold on that question to the end. But Sam, in terms of the question of evictions or the impact of insurance coverage, any comments about what you've seen in terms of the experience in Richmond?
Well, you got to know I focus on gun violence and gun violence alone. And so, but we do believe that a safe community is a healthy community, but nothing that's been done by Obama or by Trump has changed anything in these young men's lives. It's still horrible, it still sucks, and they're still fighting on a day-to-day just to survive and try to have a little bit of dignity through that process, although we wouldn't look at it like that, but that's how they've defined it. And so we have to go into their reality and live there with them to help them and guide them to a sense of real reality. And so, yeah, politics really doesn't matter. They can change laws, they can change the reentry laws, none of that matters because they're treated the same. They have constitutional rights that they don't even know about, so they're broken on a constant basis. And they don't complain because they just feel like this is what they do. This is what we do, and this is what they do. We try to get away from them, they try to catch us by any means necessary. And so that's the world that they live in, and we're trying to help guide them out of that just the red or the blue pill, as they say in the Matrix, where you want to live.
Thank you, Sam. That's sobering. Suzanne?
I will second what's been said about insurance, but regarding evictions, there was one campaign in South LA under this campaign where the advocates came out in force, packed their huge city hall in LA to demand community benefits. There's a community benefit agreement that's often built into these large projects, and they demanded full implementation of it. So they were able to secure more affordable housing. So there is ways community organizing can tackle that somewhat, but I know it's a topic that the endowment is seriously looking at, how to deal with the issue of gentrification, how to tie that into their health mission to which they're tied.
Yeah, I think regarding housing, that's definitely an issue that for Fresno, we call it the last frontier, right? So if you live in Southern California and in Northern California, you're most likely already experiencing gentrification. And so the Central Valley is really kind of the last space for affordable housing. And so we're starting to see an influx of folks from other parts of the state in search for affordable housing. And so what we've tied this into our planning efforts, our land use planning efforts, right? And so part of the work that we've been pushing at the local level is really for inclusionary zoning, right? And it's also about building an affordable housing fund. And so we actually were able to secure that last year in partnership with one of the council members, right? And so this was something that the council member had no idea about. And so this is where the expertise of our partners really came in, where we were able to shape the policy and literally kind of write the resolution in order to kind of begin that conversation. And so we're starting to think through how do we make sure that we have good policies in place to prevent gentrification that we're seeing in other parts of the state. So there's that piece. And I think the other piece to kind of the economic question is that's definitely a priority for folks across, because what we see is that we know poverty is tied to health outcomes and health expectancy, right? And we also recognize that folks that are in positions of power historically have not represented the interest of all, right? And so how do we get folks into these positions, not just elected positions, but also in these systems? And so part of the work that we've been doing at Fresno Building Healthy Communities as we build our expertise among our organizational partners, but also resident and young folks, is how do we build pathways to ensure that these are the folks that end up in these decision-making roles? How do we make sure that the public health director is somebody from our community that understands all of the challenges that our community members face? How do we make sure that our planning director, our city manager, folks at the state, right? And I think we were able to demonstrate that in Fresno through the Transformative Climate Communities process, where we helped sponsor the bill, We helped write the language for it, and we wanted to make sure that there was community engagement requirements, but not only that there was a requirement, but that there was also a workforce and economic development requirement, and that it had to be actually tangible. And so that required now, once that was approved, right, we were also heavily engaged in writing the guidelines and informing the guidelines at the state level, because we knew that that was going to trickle down to the local level. And then at the local level, we actually pressured, I mean, literally bullied the city into a participatory process, right? And so what we engaged in is the largest participatory process for the city of Fresno, where we had over 300 community members meet for about 4 months in order to develop projects and also vote on the final package for the grant application that would be submitted to the state in order to leverage the $70 million. But we helped shape that from start to finish. And so we actually helped shape that to make sure that it targeted the areas that we wanted to see investment in. And so that's one way that we can build economic power as well.
So I'm getting the signal we have to wrap up. And maybe Tony and Suzanne, I just asked maybe for some closing comments about replicability. Do you see this model being transferred to other locations different than California that maybe don't have the kind of inspired leadership that came from the California Endowment?
Well, thank you for that. But you know, I think for me the takeaway of this work, and thank you, Suzanne, for writing this great book. I mean, it's a story that needed to be told. And Suzanne and I go back a ways. I was in Alameda County when she wrote that piece that got the White House Correspondents Association Award. So I appreciate a good writer. But the story for me is that democracy is good for your health. And that we need to, if we believe that, we need to invest in it. And that's what the California Endowment is trying to do across the state. And we've seen the product of that. Now, democracy is badly broken in this country, badly broken. And so to the gentleman who asked the question about state and federal level, we've been able to reinvigorate that at the state level in California. And I think one of the innovations has been this concerted focus on trying to change the narrative and humanize the full population. We've seen that that has changed policy. It's led to significant policy changes for undocumented people, for formerly incarcerated people, for low-income people, for boys and men of color, for a wide spectrum of populations that have been marginalized and invisible in California. So we do think that this is doable, and it's been done at the state level. At the federal level, it's a horror show. And we're very worried about the increasing erosion of democracy at the federal level, and we think that that has profound impacts on the health of Americans.
Thanks. Thank you.
And I will,
And just,
can I add to that?
yes, Suzanne, please, closing comments.
Real fast. I think when you begin to start with ground up, democracy is revived and it trickles up, it could make its way to the federal level. You got more people voting for their federal officials. You got more people voting for the president. We all know it swung by 70,000 votes for the presidential election. And what's different with this initiative is they have what's called a state team. It's grassroots to treetop. So they have a politically savvy team in Sacramento to listen to what's going on in the community and say, hey, we see possibility for statewide law. So they passed them, and that's the school discipline reform, that's health for all, healthcare for undocumented and others. And if this model can keep, basically it's lobbyists for the poor. You're getting lobbyists for the poor in the Capitol. So if you can finally keep working this and get it up to the federal level, it's a long slog, but it's possible.
So I would say another way of replicating, spreading, and scaling is reading the book, and then sharing it with others, because it in clear, very human stories, it makes the case for this kind of model. So please join me now in thanking just this terrific panel. Great.
Thank you. I know I'm standing between you and getting on with the rest of your day, but just give me one more minute. What I want to say is, for community solutions, is Dr. Iton was right. We really believe that community does have the answer, and that's a lot of what our work is about. So thank you. And also, copies of the book are available on the blue table as you go out. Suzanne said she will sign them. They're free. The California Endowment was nice enough to donate some books to the cause, so please take one and have Suzanne sign it if you would like, and read it and pass it on and share it. Get people to buy it, though. Don't just give your copy to other people. Like, have people buy the book. Read your copy and tell people they need to buy the book. And the session is being taped, as you know, and we will share the link with you so that you can share it with friends and continue this conversation. Thank you very much for joining us, and good luck with the rest of your day.